Today, we will begin our session for training in Holy Regional Hospital. I have the honor to be with you today. And today we will speak about the patient preparation and transmission for different radiological units. It is considered important and simple topic. I have the honor to introduce myself for you. I am Dr. Ahmed Mukhtar Abu Dahab. I am staff member and consultant of radiology in Radiology Department, Faculty of Medicine, Sohag University, Egypt. I was the former vice manager of Sohag University New Hostel, certified trainer in Supreme Council in different universities, and speaker in the Virtual Medical Academy in the Kingdom Saudi Arabia. And I was a consultant and senior registrar in Sohag Military Hospital, police clinics, Saudi German Hospital, and Olay Medical Center in Saudi Arabia. Right. We may know or don't know the radiological modalities. The radiological modalities in general are a lot, but the most famous of them, as we know, the first one is the X-ray. The X-ray, as all we know, is the oldest and the most famous radiological modality. The next one is the ultrasound. As you know, we are daily here doing X-ray and ultrasound every day. The ultrasound is Doppler considered as a branch of the ultrasound. It is an examination of the vascular system. And there is the CT, computed tomography, and the MRI, magnetic resonance imaging. CT and MRI considered somewhat advanced imaging modalities. This is not only the imaging modalities available, there is another advanced imaging modality, such like PET CT, SPECT CT, radioisotope scanning. This is not only the radiological modality, but these six are the main radiological modality in every radiological department, large departments in general. All right. What is the meaning of patient preparation? If I ask you, want the lecture to be interactive, not only I am speaking only, what's the meaning of preparation? Yes.
It is ready for the procedure.
Yes. Makes the patient ready for the procedure with the best partner to give me the best examination. All right. So, for the radiological, for example, in radiology, we have a general rules for preparation and specific preparation for certain modalities. The general rules of patient preparation, for example, the first thing is the fasting. Fasting in general is a common base for preparation. Don't worry about taking photos. I'll send the file in PDF for everyone new. Don't worry. I'll send all for all of you. So, for example, when we are doing any exam for the GIT, gastrointestinal tract, the patient must be fast. Because if the patient is eating or drinking, it will be full with gases and the gastric contents. This will be masking our finding in the radiology. The second one, if the patient will take intravenous contrast material intravenous, so the patient should be also fasting. Why? If the patient is not fasting and taking intravenous material, this make him maybe to be vomit. And the vomiting will be causing a problem, such like aspiration, such like complication to be occurred with this situation. For example, we have to remove every foreign body, clothes, dressing, rings, for example, before the examination of radiology in general. But this is not for ultrasound, mainly for X-ray and CT. Finally, or not finally, mainly we must consult the radiologist before scan. For example, some certain examinations need certain type of preparation, so it's best if I don't know, I ask the radiologist what I do for this patient. This is the base or the general rules for preparation. Let's transmit to the rule, not number one, number 0 in preparation. We must know that CT and X-ray both are ionizing radiation. What's the meaning of ionizing? Ionizing means when this radiation hits the body, it may cause some harm. This is according to the dose of the radiation. For example, the X-ray, the dose of X-ray is low, while the CT have a high dose of radiation. So the first step for preparation of patient for X-ray or CT is to exclude that the patient is pregnant. This is the first step before anything. She will do X-ray, she will do CT. The first step, she's married, are you pregnant? If suspicious, it may be pregnant, I must stop the examination, never to have the examination, and consult the radiologist. If you please, sir, this patient is pregnant, what's your opinion? According to the state, for example, if she's advanced in pregnancy, if the pregnancy in the last of the pregnancy, the fetus is full, no problem to have X-ray. But if the pregnancy is early, the X-ray and CT, especially CT, will be more dangerous when the pregnancy is early, right? At the first stage. to prepare the patient for X-ray or CT is to exclude that the female patient is pregnant, right? Let us discuss the different steps of preparation in the different modalities. For example, about X-ray. To prepare the patient to have X-ray, the first thing is to remove radio-opaque objects. For example, the patient is wearing a large ring. The patient is wearing clothes on the neck. The clothes of the patient contain metallic substance, right? Anything metallic, pins. These metallic objects, it must be not involved in the film. So I must ask the patient to remove everything metallic from the clothes before doing examination. For example, this patient, I don't know if she's swallowing this metallic object or this metallic object in her clothes. For me as a doctor, when I see this film, I ask myself, what is this? Is the patient swallowing this or the patient wearing this? So I must remove anything radiopaque from the patient before doing the examination. But don't be strange when found something like this. This case, I was take the X-ray of her by myself, and she was a young girl. She had a nausea, tried to vomit. She used this spoon and tried to initiate vomiting. She swallowed the spoon such like this. This was the size of the spoon, as you see. It was large enough. And because the case is very strange, we published it as a research. Radiological diagnosis of foreign body ingestion spoon. This is in the International Journal of Advanced Biomedicine. We published it in the last year because it was a strange case. She was a young girl. Yeah. So I want to explain to you why I should remove the object. So I can explain the patient may swallow anything. All right. All right. The next step is, as we said in X-ray, is fasting, especially when we do the X-ray on the abdomen. The patient is better to be fasting. Or the patient may need laxative. You know what the meaning of laxative? Laxative is the medication that make evacuation of the GIT, evacuation of gas and so on. Why? We can see the next slide and judge. For example, for the BUT or QB, BUT means plain urinary tract. X-ray on the urinary tract without contrast, or QB is the same. Kidney, ureter, and bladder. BUT and QB are the same names. For example, you can see this and this. This patient is not prepared. As you see, there is excessive gases and fecal matter inside the abdomen of the patient, so it can mask the stones, it can mask the abnormalities we can see, while this patient is good prepared. So when the patient is prepared, it's easy for me to see the stone, to see the abnormality. So the preparation is very important for the patient and for the doctor for diagnosis. About ultrasound, what is the first step for preparation of ultrasound? Abdominal ultrasound. Many times my dear sisters in OBD ask me, the patient is not fasting, she wants to have ultrasound. The best for the patient of ultrasound is to be fasting. Why? The gallbladder is a main target for ultrasound and the main cause of complaint for many patients, especially females. So it is best for me to be the patient fasting. The gallbladder is full when the patient is fasting like this. As you see, this is the gallbladder, it is full, and this is the stone. So easy for me to see the stones or abnormality when the patient is fasting and gallbladder is full. While if the patient is eating before examination, the gallbladder will be empty. When the gallbladder will be empty, I can see the abnormality inside. So the patient will not take the benefit of the examination. So the first step for preparation of abdominal ultrasound, the patient should be fasting at least for an hour or maybe more. The second step for preparation for ultrasound is when the patient is a child. For example, when the baby or the child is cooperative, such like this nice boy, I have no problem to have examination. But in certain situations, the baby may be agitated or afraid or weeping. This may need to give the patient hypnotic, make him asleep. But this is not given by anyone except the pediatrician, the pediatric doctor. We want the patient to just asleep for 5 minutes to have our examination. So, and sometimes we need to do this with patient like this. This must be, of course, he must be asleep. I can't do examination like this, or like this, as you see. Yes. About the preparation of the pelvis. For pelvis also, fasting is important to eliminate gases inside the lower abdomen. And the full bladder is very important for us. The urinary bladder, to be examined well, the patient must have the bladder full. May I need to examine her again after emptying, but I must see her in the first with full bladder or him, and then may I ask him to evacuate. It's easy to see it full and then evacuate, not to see it evacuated from the beginning. So the basal is the patient to come in full bladder, and if I want to see him with empty bladder, I ask the patient to empty the bladder, and we are completing our examination. Is that clear up to now, or there is a problem? Any problem? Raise your hand and ask, no problem. All right, about the Doppler. The Doppler is the examination of the vascular system by ultrasound. Doppler need no preparation except to make the patient organ fully exposed. For example, if we have Doppler for the lower limb, for example, we must expose the whole lower limb of the patient from the beginning of it until to the end, because the vascular system should be examined all of it all over the limb. If examining upper limb, I must expose the limb from the beginning to the end. If examining the neck, I must expose the neck of the patient, and so on. About CT, I know that we have in CT here, but as you are a team working in a medical field, you must know at least the basis of this indication. For example, as we said before, the first step for preparation of CT and CT specifically to be confirmed that the patient is not pregnant, because the CT has a high dose of radiation. So the CT, if the pregnancy is early, this may make a teratogenicity. Understand what the meaning of teratogenicity? It's the abnormality of the fetus. The fetus may be born without any, with a problem in the eyes, in the brain, and so on. So the first step to confirm any female patient will have CT, we must confirm that the patient is not pregnant. For example, she may be pregnant. If the pregnancy is advanced in the last of the pregnancy, and we should have the CT, we are covering the abdomen of the patient with apron, lead apron protective, and ask the technician to do the technique with the lowest dose of radiation. We may do have CT with the patient who is pregnant, but we must do it very carefully and with under supervision of the radiologist to be his responsibility about the case and his decision, right? For example, as we said before, if the patient take intravenous contrast, the patient must be fasting. An oral contrast also, the patient must be fasting, and to remove any metallic object is mandatory. As you see, this is rings, and this is the artifact disturbance of the image caused by this ring, especially in CT. So we must remove any metallic objects in the patient or in the glosses before doing the CT examination. All right, there is many types of artifacts occur in CT, but the most important for us is the artifact of the foreign or metallic object that we can remove. In the MRI is magnetic resonance imaging. Simply, MRI is a huge, powerful magnet. The MRI machine, the magnetization of it is equal to about 10,000 times of the Earth. You can imagine? If the Earth, I am throwing something on the Earth, it is attracted by the gravity. If I throw an iron object to the MRI, it will be attracted 10,000 times than the land. You can imagine, all right? So any iron or magnetic object, it is never to enter the MRI room. Let us see. You will never forget this image. The first contraindication is the patient of pacemaker. Pacemaker is the regulator of the heart rhythm. Some patients are implanting certain device regulating the heart rhythm. This patient, if exposed to MRI, he will die that second. So we must ask the patient about pacemaker, must exclude anything metallic or anything magnetic, shouldn't enter to the room. If the patient is entered with it, that would occur. Let us see. Such like this. As you see, the machine can attract the patient with the bed. This is an example for accident. It's another example. The chair, all of it is enter inside the magnet because the powerful magnetization of it. You may ask a question, what is the solution? The solution is the MRI machine has its own chairs and its own beds specific for MRI that's suitable to enter, not formed of iron, formed of aluminum, of any non-ferromagnetic material, with material not attracted to the magnet, right? But the usual moving chair like this or the usual beds, this is formed of iron. It will be attracted forcefully and rapidly to the MRI. You can see this. This is an example for, imagine if the head of the technician is here and a patient enter with this iron room. What will occur? You can see, look. The head will be distracted by the force of the severe magnetization of the machine. It will be like this. So you can imagine the problem. The second step of our talk today is about patient transmission. The patient transmission is not only for the radiology units, for any unit in the hospital. It has a certain basis, we must know it very well. The first one, that the patient transmission is not related only to the modality, but it's really related to the state of the patient. Except in MRI, as we said, we must use the beds or moving chairs that belong to MRI. But the zero step, that radiological unit are receiving stable patient. It's not suitable for me that the patient is coming in accident and has a shock and bleeding and about to die, and I take him to do ultrasound. No, I must take him to the ER to preserve his blood pressure, preserve his pulse, preserve his vital signs before I think in transmitting him to the radiology unit, whatever. For example, two patients in the same accident, the stable one will go to do CT and ultrasound, but the unstable one may enter to the operative theater directly without doing radiological examination. So the first step to transmit patient to radiological unit, that the patient must be stable. Stable according to what? Stable according to airway, preserved airway of course, breathing, is breathing well, and cardiovascular system about the pulse and blood pressure. All right. So the first step in transmission of trauma patient is to stop bleeding. For example, I found the patient have accident and he has active bleeding. I'm not searching in radiology before stop of bleeding. The first step is stop bleeding, and then I'm thinking in do investigation. This is the first step. The second is to fixing the injured part. For example, he has a fracture. It is never to move the patient with the fracture. Moving with the fracture may grave it, may make it more dangerous or complicated. So I must fix this injured arm or limb or part before thinking in transmission of the patient to any site. The third, we must move the patient as one unit. For example, it occurred that the patient has accident, he has a simple fracture, but they carry him like a baggage of fruits. So we found the fracture transmitted from simple fracture to complicated fracture. So we must move the patient as one unit until we can move him with a bed or a chair or something like this. So, never to use non-compatible devices with MRI. Again, we said about it because it's very dangerous. For example, as you said, all these are real accident for MRI due to, this is a bed of anesthesia, this is a moving chair, this is, I think this is not a patient, this is maybe a technician. This is another patient, for example, this accident occurred in India. The patient was entering the room with oxygen, bottle of oxygen, so it's attracted to the machine, such like this. This may injure the patient up to be fatal for him, for example, and the problem, this will be destroy the machine itself. We can't remove these devices, such like this, as you see, with any powerful. We have to diffuse the machine, which may be costing for millions of rupees or several thousands of dollars to regain the machine working again. So I try to end my talk with this photo to make every one of you remember this about MRI, because it's very dangerous and very important situation. Finally, I want to thank every one of you. These are the references, sources, and further reading about the situation. And we can now open discussion for asking. Repeat my thanks and regards, and thank you for listening. Good luck. We can open now the asking questions. Any question you want to ask, you can ask.